presentation is about viral STDs, and this is by Kirsten Fredman, Tara Poole, and Megan Zentek. The common viral STDs that we're going to cover are herpes type 1 and 2, HIV, genital warts, or HPV, and hepatitis A, B, and C. Herpes type 1 and 2 symptoms and indications. The most common viral STD in the United States is herpes. The most common herpes symptom is a cluster of blistery sores, also known as papules. They occur usually on the vagina, the vulva, cervix, penis, buttocks, or anus. Symptoms may last several weeks and go away. They may return in weeks, months, or years. HIV symptoms and indications. Symptoms may include swollen glands in the throat, armpit, or groin. Patient may develop a slight fever, headaches, fatigue, and muscle aches. Symptoms may last only a few weeks, and then a lot of times they go dormant and there's no symptoms for months or even years. AIDS symptoms typically appear in the most advanced stage of HIV. In addition to a badly damaged immune system, a person with AIDS may also have thrush, severe or recurring vaginal yeast infections, chronic pelvic inflammatory disease, tiredness, dizziness, headaches, rapid weight loss, bruising, and severe and frequent infections. They may develop rashes, growths, shortness of breath, and dry coughing, and these are only to name a few. Genital warts and HPV signs and symptoms. So HPV is a virus, and that virus causes genital warts. HPV stands for human papillomavirus. And some of those symptoms include single, small, flesh-colored, soft to the touch, bumps on the skin, which may look like cauliflower. They're usually painless, but they may itch. They can be on the vagina, the vulva, penis, cervix, anus, or urethra. Sometimes, but less occurring, you can get them in the mouth, on your tongue, your lips, your soft palate, or in your throat. Hepatitis A, B, and C, symptoms and indications. Oftentimes with hepatitis, there's no signs or symptoms. 1 and 2 adults with hepatitis B actually show no symptoms at all, but the symptoms do include extreme fatigue, tenderness and pain in the lower abdominal area. You get loss of appetite, sometimes nausea, vomiting, painful joints, headaches, fever, hives, dark-colored urine, jaundice, and pale-colored bowel movements. Hepatitis C, a lot of the symptoms are the same as the ones I just listed. They may include severe itching on the skin and water retention that bloats your lower stomach area and sometimes your legs. And then they may bruise easily and also bleed easier. Herpes treatments include goals to decrease comfort from lesions, promote healing without secondary infection, decrease viral shedding, and prevent transmission. There's a chart in the Med-Surg book for palliative care. It can be found on page 1536. And the other treatments are antiviral drugs, and a lot of us are familiar with Valtrex or Zovirax. And these are available in IV if the patient is hospitalized for a severe infection. HIV treatments. We know there's no cure, but strict adherence to antiretroviral regimens can dramatically slow the disease process and prevent secondary infection and complication. There are 24 different ARVs that fall into 6 main types. Each drug fights the virus a different way, and combo therapy is usually prescribed to control the virus and avoid drug resistance. Current treatments for genital warts and HPV. For the genital warts, the goal is to remove the wart. So no current therapy completely eliminates HPV infection, and recurrence after treatment is likely. But for the warts, typically there's creams that can be applied topically. Also, cryotherapy is an option. So hepatitis treatment. For all hepatitis, bed rest, abstaining from alcohol, and taking meds to relieve your symptoms. There's no specific treatment. The body usually fights this off on its own in a few weeks. If you're immunocompromised, obviously this could be a problem. The treatment's going to depend on the severity. If you need it, They have antiviral drugs that are usually prescribed by the provider. Viral STD nursing assessments. First of all, we want to build a rapport with the patient, and this facilitates trust and helps them to divulge information. Of course, we want to obtain a full health history, but also a sexual history. We want to do a risk assessment. We also want to do a physical examination of the patient. We're going to be assessing for heavy or abnormal discharge in females. There could be some urinary frequency. We could be looking for ulcers, blisters, warts in the genital area. Symptoms may include the low-grade fever, malaise, itching or irritation, abdominal pain, or anxious behavior. And of course, we're always going to want to obtain viral cultures if it's indicated. General education and teaching. So how are we going to educate our patients? Well, when we talk about STDs, obviously they are sexually transmitted. So the first thing we want to do is educate on safe sex practices, and that's the most important and preventative tool. For primary prevention, we want to focus on vaccines, so the ones that we know are available, Gardasil and our Hep A and B series. Our secondary lines of prevention, as far as teaching, we're going to teach them about routine pap smears, STD screenings, safe sex practices, so condoms, monogamy, abstinence, and decreased number of partners. And then we always want to look about and teach about drug and alcohol use. Obviously, this could be risky behaviors, and risky behavior leads to more risk for contracting sexual diseases. We want to educate our patient, not only them, but their partner. So, especially if this patient already has a disease, you got to bring their partner in because they have to be treated too. Modes of transmission, we're going to talk about incubation periods with our patients, treatments, and any complications they may be facing. So after we're done teaching our patient, obviously we always want to do an evaluation. So we're going to encourage social support for our patients. We want to make sure that we're always screening for depression. We want to make sure they're not isolated, that they're not having feelings of rejection and or embarrassment. Encourage follow-up appointments for these patients. Make sure that they're aware that these diseases are communicable, and they're easily spread, and they are reportable as well. Make sure that they're practicing safe sex. Advise the patient to discuss the diagnosis with current and future partners, and also instruct the patient in the use, the side effects, and the risks of any antiviral drugs that may be prescribed to them. Thanks for watching our video. We hope you enjoyed it.